You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hey, I'm Zach, and I'm really excited to introduce a guest today, Dr. Michael Blackwell. Dr. Blackwell serves as a director of Pet Health Equity Program at the University of Tennessee. He is the founder and president of AlignCare Health Inc., a One Health interprofessional system that helps underserved families access veterinary care. Previously, Dr. Blackwell served as Dean, College of Veterinary Medicine, University of Tennessee, Chief of Staff, Office of Surgeon General of United States, Deputy Director, Center of Veterinary Medicine, Food and Drug Administration, and Chief Veterinary Officer, U.S. Public Health Service. Oh my God, what an experience. Dr. Blackwell, welcome to the show. Thank you for finding the time.
Thank you so much. I am so honored to be here today.
Well, the topic that we chose to discuss today is the access to care through this new innovative approach where One Health, as I assume, joins somehow efforts from both human healthcare angle and the veterinary. Can you tell us more about it?
Sure. Access to veterinary care is largely a human reality topic. So when we think of those who struggle to access care, those who struggle to provide the care to certain underserved families, there are human factors at work here. In other words, the pets are the dependent individuals in that picture and the victims of systems that fail to help them. Unfortunately, in animal welfare and veterinary medicine, historically, we've been very animal centric in our business models. The client has a role, which is largely to pay the bill, get the pet there, pay the bill, and of course, administer meds at home in some cases. We need to get beyond that and understand that in both the US and Canada, the vast majority of families with pets consider them family members and they behave in that manner. Healthcare is needed for all members of that family. And so when we don't ensure that a certain member of the family does not have adequate access to care, we threaten the health of the family at large, both emotionally, mentally, and physically. And so one key takeaway we believe is important is that we shift our paradigm from being animal-centric to family-centric, and specifically pet family-centric. We will leave the livestock and wildlife out of this conversation today, if that's okay.
That makes a ton of sense. So it's really interesting. I mean, listening to Ivan read your bio and understanding a little bit of your career, it's obvious to understand why you're so passionate about this topic. I want to dig into this idea of the health and well being of the family and how that relates to access to care and why it's so important to you.
Yes. Most people I talk to think about compassion as the major driver for caring about access to veterinary care. That's important. But a bigger driver in my mind is safeguarding public health because 65% or more of the infectious diseases that humans can get are zoonotic. The microbe is found in one or more species of animals. Pets don't represent most of those exposures, but pets do have the ability to expose their human members of the family to parasites, viruses, bacteria, and the like. And so when these pets don't have access to health care, we're not preventing and controlling zoonotic diseases, not only in families, but in our communities. And if you play that out unaddressed, we can predict that our countries will be spending more money on treating diseases that were totally preventable with very little dollars in a relative sense by simply ensuring the pets have access to care. So low-income families, those who don't have adequate access to care, have a higher probability that they're affected by zoonotic diseases, and not only infectious, but parasitic diseases. And let's not forget the mental health piece. When you love an individual that is depending on you for their well-being, and they are in need of hope, and you are powerless to help them and you have no hope of helping them, what does that do to your own mental, emotional health? And these things are playing out as we speak every day, and there are costs associated with those outcomes. So, yes, both mental and physical health is at risk when we are not insured and pets have access to veterinary care.
That's very well said. And from your angle and the how much you participated in sort of governance and public sector, and it's definitely the right angle. It's not. I love that it's not just the altruistic people need help, but it's also there's a public safety risk. I had an interesting experience 2 days ago. As much as I'm actually pragmatic about pet ownership because I try not to get attached. So I had chickens. I had 6 chickens, and we brought fertile eggs for my daughter. She's 5 year old to experience little chicks to be born. But I didn't think I was attached to chickens, and we had a mink get into the chicken coop and murdered all of them overnight.
Oh, man.
And it was a bad experience. It was as much as I'm a veterinarian and euthanize multiple pets, and I've seen families in distress. It affected me quite a lot. Just the part of how you attach yourself to just a companion, whether it's a chicken, a cat, a dog, or any other species. So that's just a recent experience that I wanted to share, and how much they can become a family, especially when I see my daughter playing with them, and all of a sudden they're not there for whatever devastating reason. This one was kind of a part of a nature, but some things could be preventable. And how do you go about that? I mean, in my case, I need to build a better chicken coop. I understand that. But for the families that cannot provide, how do you see the nationally, internationally, how can we address this to be effective at providing this access to care?
I'm so sorry that your family had that experience. It sounds horrible. And yes, the human animal bond operates at even a mystical level, if you would. And one can't presume that species X would not afford some kind of bonding with a human, or the human is experiencing a bond. This is true for livestock producers, even. Yeah, they have economic realities that they care about, but it gets beyond that. So I really wish you all the best as you transition to another approach to what is a wonderful way for your child to learn some things about life and about nature and so forth. The big question that is on everyone's mind is, well, how do you pay for this care? There are tens of millions of pets in the US, tens of millions of pets in Canada that are not getting access to care. And someone needs to pay for it because they are not getting access to care primarily because of financial limitations experienced by the family. I will tell you, there are researchers, hopefully, that are listening to this discussion, and we need better information, better data, in helping us to understand what are the healthcare cost savings when families live with pets. There's a growing body of evidence that there are true savings. Last year, the Human Animal Bond Research Institute here in the US issued a report that included $22.7 billion that are saved when people live with pets. So that's just one part of the picture. The other part of the picture is, what are those true costs when pets don't get access to care? And I mentioned earlier, there are both physical and mental health poor outcomes when access to care is not ensured. What does that translate into? Does that increase the number of visits by the humans into the healthcare system? What are they coming back into the system with? And again, we're thinking both mentally and physically. We can use some easy low hanging fruit, seniors. It is known that when a senior is experiencing loneliness, isolation and loneliness, that their morbidity and mortality is worse, that they're more likely to be unhealthy, both physically and mentally. In contrast to living with another individual where they may be more socially engaged, may be more active, sometimes the other individual is not going to be a human for various reasons, while a pet could represent a very effective and reliable way for that senior to have another entity in their presence in their lives. And so when we start to do studies to better understand those true costs, what I'm sure we will find is that our healthcare systems are burdened beyond what they have to be because we're not doing more of the preventive end of things. In this case, pets having access to care, pets being present in the family are helping to lower those costs. And so, for the researchers and the audience, by all means, as far as those who are providing care, the veterinary service providers, we are advocating strongly for better collaboration among the sectors that support family health and well-being. It's beyond healthcare. It includes housing and transportation and the social service, public health. When we look at the sectors that are important and their missions for ensuring family health and well-being, and we ask ourselves the question, well, are they aligned? When someone is addressing housing policy in the community, to what extent are they factoring in that the majority of families today actually have pets and need access to housing? When we look at public transportation, when we look at how we ensure that families can get from point A to point B, are those policies actually in line with the makeup of families today, where the majority in our communities actually have pets? And if we keep thinking about that unit, the family unit being a biodiverse unit of humans and non-humans, and then we take a step back and look at our policies and procedures within our programs and systems, I think what we'll find is a wealth of opportunities to make adjustments so that we are doing a better job of supporting the families. And why do we want to do it? Because it's going to save money overall, not only in our programs, but overall in our nations as we try to ensure family health and well-being.
Yeah, that was very eloquently said. And I think the makeup of the modern family is changing. I mean, I live in downtown Toronto most of my time, and I go out for a walk every day or a couple times a day. And there's not very many children, but there's an awful lot of pets. So it's interesting that the makeup of the family is definitely changing. It's more pet centric. So everything that you're saying makes a lot of sense to me.
Sean, in the United States, less than 4 out of 10 households have children in them. We're approaching 7 out of 10 that have pets in them. Not quite doubled yet, but we're headed there. So, yeah, that word family should be formally redefined to be in sync with how our societies are made up today.
So, Dr. Michael, tell me about AlignCare Health, what your mission is, what you're trying to accomplish, and maybe tell us when it started.
Sure. Aligned Care was conceived out of the idea that a One Health system is what veterinary medicine needs to be part of, that we exist in a silo separate from the larger healthcare system. Why do we want to be integrated with the larger healthcare system? It's because barriers to family seeing us are attended to better by the larger healthcare system, from finances, financial support, to mental health support for families and so forth. So, this is a structured One Health approach by allowing families to enroll into this system, be linked to a veterinary practice that will provide the veterinary care, but also through social work, social workers, and others trained in the system, connect those families with other needed resources in their community. As far as the funding, all avenues of funding that support animal welfare or family health are potential sources of the funds. And we've seen those funds flow from nonprofits to business, from businesses, private citizens, and even government into a shared community fund account that pays the subsidies. That's it in a nutshell, but I may have confused you with some of what I tried to say. So I'll take any clarifying questions, and we welcome people to contact us for more information.
Excellent. It reminds me of this concept of One Health was even with the same nomenclature was kind of named in approach to medicine as well, which was interesting. There's a couple companies that are combining the research between especially in, I think it was in cancer research. There's something like that where they use the models and kind of instead of simulating the certain diseases, they find amongst the veterinary patients the same condition that they could do research on the medications and approach. I think it was in chemotherapy. So the concept of combining the healthcare and veterinary care is not new, I think, in general. But what do you, as a big dream, what do you see the organization do in 5 years from now? What does it look like? What's the big dream?
AlignCare will become the nation's system for ensuring a connection between the veterinary medicine industry and human health care. It will get there because of, as I mentioned a moment ago, the structured design. We're able to collect the kind of data that will inform decision makers, from legislators to policymakers, about how to adjust their systems, redirect resources in order to, again, have a more efficient, more cost effective way of supporting the health of families, in particular families that have pets as family members. Some would say that it would be the equivalent of a Medicaid such type system in some respects. And I think that may be a valid analogy, although not a government program. It would live and exist in the private sector.
Well, if anybody can do it, it's the person with your caliber. So we're in good hands for this. We appreciate you joining us on this podcast. There's two questions that we usually ask at the end of each episode. Is there a book, a TED Talk, a video, or something that inspired you recently that you would like to share with the listeners?
Yes, not a specific book, but actually a new development in technology, which is artificial intelligence. I'm really fascinated about how the world will look and operate over the next 3 to 5 years because of artificial intelligence. I'm finding multiple ways to utilize AI in the work that I do. I'm amazed at the amount of time that I'm able to save because I'm using that technology. So I think I know there are those who still have some heartburn around AI, but I kind of view it the way I did when the internet was just starting to bubble up and there was resistance. Find me a person who really wants to live in the world without the internet, without the access to the information available by way of the internet. So this is on an even larger scale of a change. And I would say my life and work has improved because of AI. It's not where I want it to be yet, but I'm optimistic.
It's amazing. And the last question we've got for you, Dr. Michael, before we let you go, is another innovator that you think we should invite to this podcast.
I think veterinary medical education is at best 20th century, maybe worse, 19th century by many metrics. We need more innovations in veterinary medical education. And I think it'd be great for your folks to hear from Dr. Tina Tran, who is the founding dean of Hanover College of Veterinary Medicine. Tina is among a number of individuals who's trying to bring more innovation in how we train veterinarians and the strengths gained through use of technology and so forth.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.